This is a video just to demonstrate the awake proning protocol that we'll implement in the emergency department. So our patient Nancy has just been brought back a little while ago into the room. Nancy's been diagnosed with COVID a few days ago. She was sent home on COVID watch with a pulse ox to use at home, and noticed that her pulse ox had dropped to 80% and she was feeling more short of breath. So she decided to come into the emergency department, and she had triage vitals of a heart rate of 100, blood pressure of 120/80, temperature of 38.3, and a pulse ox of 80% on room air. So she was brought back into her room and was placed on 6 liters nasal cannula oxygen. Gabby and Kaitlina are the treatment team. They're just coming into the room to evaluate Nancy.
Hi, Nancy.
Hi.
Hi, Nancy.
Hello.
I'm Dr. Stillman. How are you feeling right now?
Short of breath.
Yeah, well, we're concerned about your oxygen saturations right now, because despite the 6 liters of oxygen that we're delivering through your nasal cannula, your oxygen saturations are still low. They're only 85%.
Okay.
So, Gabby, what do you think about trying the awake proning protocol?
I think we could do that. We have a 3-to-1 assignment in this area, so I think we can manage it.
Perfect, so we have enough staff. So Nancy, I'd like to try a maneuver here.
Okay.
Do you think you'd be able to lie flat on your stomach?
Sure.
Okay, so by doing this, we think we can increase oxygenation to your lungs and help you feel a little better.
Great.
We've seen it done in prior patients before. There's not a ton of evidence to support it, but it has worked in the past.
Okay.
Now, the point of this is to prevent having to put you on a ventilator, and so we'd like to avoid that as much as possible. There is still a risk, despite doing this, that you will have to be put on a ventilator. Are you okay with that?
Okay.
All right, great. So let's just go through some of the indications here to make sure that we have all of them. So we know Nancy is COVID positive, we have a chest x-ray.
Yeah, this chest x-ray did show bilateral infiltrates.
Okay, great, that's one of the indications. We know she's sat in 85% on 6 liters nasal cannula, which meets criteria. Her vital signs are hemodynamically stable, which is good. And then we know we have enough staff to be able to monitor her closely. As far as contraindications, so Nancy has a GCS of 15. Do we have a VBG on Nancy?
Yeah, VBG was taken earlier and the PCO2 was 40.
Okay, perfect. It's it's less than 45, so that's good. We know her vitals are stable again. She's not agitated. We have a urine pregnancy test that confirms she's not pregnant. She's not morbidly obese. Nancy, do you have a history of COPD or any spinal injury?
No.
Great. She has no devices like chest tubes or other invasive things going on right now. So I think we can proceed with the protocol.
Okay. So Nancy's in the
Yes.
negative pressure room. Do you have to go to the bathroom?
No.
right now? Okay, she doesn't have to void. So I'm gonna lay you flat first.
Okay.
We're gonna put the side rails up on each side for safety.
Okay.
And then we're just going to ask you to roll onto your stomach. You get as comfortable as you can. Perfect. We can put her in a little bit of reverse Trendelenburg for comfort, and we're just going to make sure that we put pads under any pressure points, such as her knees and her elbows. Lift this leg up for us. And then we'll give you a blanket or a pillow here at your head.
Okay.
At this point, we would also continue to monitor her telemetry. We would place the stickers on her back, and then we'll also monitor her oxygen and blood pressure, and we'll continue to do this for 2 hours and reevaluate.
Great.